company in the world. And I'm sure we can say in the world, but I'm sure I'm saying the world as a proud Kenyan. Let's talk about it in the region. Which means that with the good corporate governance and good leadership at the corporate level, NHIF can do wonders in the same way Safaricom can do. NHIF can become the Safaricom of healthcare. And with NHIF becoming the Safaricom of healthcare financing, universal health coverage can be covered. But if you look at the trends at which people have been moving, I've known that thing a lot because I'm at play in the industry, I don't want to say much. But if you look at the board, they have representation. For example, there's somebody representing religious leaders. There are some people representing the peers. And currently there's a Muslim representing religious leaders. And there was a claim, why is Catholic Church or Christianity offering most healthcare not being in that board? So there are those politics that are there. Mm-hmm. But what I believe is that good corporate governance will work. Like if I look at the numbers I was trying to tell you, strategically, NHIF is giving empanelment to people who cannot offer healthcare to Kenyans and avoiding to pay claims, like I've told you. Like he said, and actually he can clarify that, more empanelment is going to public facilities without drugs, without medical practitioners, and without facilities to offer healthcare. Less is going to private health hospitals, and you look at more claims go to private hospital because whenever they're given empanelment, they can treat patients. And I think they need to change strategy of not being too much pro-public, but also being pro-citizens, because what is important is offer healthcare. And in fact, if you go to some developed countries or even just go to India, public health facilities seem to offer better healthcare than even private. But for us in Kenya, anything public means inefficient, ineffective, poorly run. Anything private is more efficient, more effective, and better run. Which means that in Kenya, they're a better run hospital. In Kenya, they're better run health insurance schemes. Like you talk about the issue of fraud, I can actually tackle that. The 30% of fraud is an issue, but even a worse issue is where people are given medicine they don't take, where is the abuse. I did statistics when I was doing some work for insurance company, and I found that there is over 3 billion worth of medicine which is given in hospital paid off from insurance, which are never taken. Like if you go to hospital, you are given a big chunk of medicine which you don't need to recover, but just because you have a paying power in terms of medical card, you are given which you don't need. For example, I've even saw the time they gave my son something like inhaler, which he does not need. It was just because we have a medical card. So we have all these abuses. And for me, to rectify this, which we did for healthcare, is that NHIF need to employ medical doctors who know all the fraud loopholes that are used by their fellow medical doctors to steal medicine. They say, set a thief to catch a thief. That's the only way to go about it.
Well, I don't know whether that is practical. Yes, Marie.